Okay, so I'm doing my psych research presentation on the relationship between TBI in childhood slash adolescence and the development of mental illness. So the scope of this is TBI is the leading cause of death and disability in children in the United States. Concussion, which is the mild form of traumatic brain injury, uh, is particularly common among children, and it affects about 45,000 kids every year. A wide range of mental illnesses can present following TBI, including ADHD, which is the same as normal ADHD, except it occurs prior to being 12 years old. Aggression issues, personality changes, internalizing disorders such as issues with mood and anxiety, and PTSD. Uh, Research suggests that the number of TBIs and also how closely they happen together can also contribute to the number of and severity of long-term issues that develop. So, sources that I'm going to go over. The first one is mental health implications of traumatic brain injury in children and youth. It is a literature review, and the findings were that the risk of getting a traumatic brain injury uh, in childhood is more likely if the child has pre existing psychopathology uh, and also whatever their pre-existing psychopathology was will most likely increase in severity following the injury. Uh, Mental illness frequently follows TBI, especially ADHD, personality changes, and conduct disorders. They also found that very few children are receiving mental health treatment following their injuries. The second source is suicidality, bullying, and other conduct and mental health correlates of TBI in adolescence. Uh, this study was a survey of 2,685 students, grades 7 through 12 in Canada. They found that students with TBI, with a history of TBI, were more likely to report more psychological distress, more suicide attempts, more seeking of counseling, prescription medications for depression and or anxiety. They were both more likely to be bullied and more likely to be bullies, um, and also more likely to engage in violent behaviors than their peers who had not experienced TBI. The final study that I am going to share is self-reported TBI in male young offenders. This was a study of 186 11 to 19-year-olds from the Young Offender Institute, also in Canada. They found that 70%, or not 70%, 46% of participants reported TBI, history of TBI with loss of consciousness, and 29.6% of those were mild TBIs or concussions. They also found that those with a history of TBI, uh, the greater the frequency of head injuries, the greater number of convictions they had, the more violent offenses, more mental health issues, and also increased cannabis use. So the recommendations of the literature, uh, patients post-TBI are at an increased risk of developing mental health issues. Because of this, primary care providers should be following up with their patients and screening for potential mental health and behavioral issues following TBI, and efforts to prevent TBI can not only reduce injuries, but also decrease the number of comorbid issues uh, that children are living with following the injury. Some suggestions for further research is researching when the injuries are occurring in childhood and if that has um, any effect on what illnesses are presenting and the severity of the illness. We're not doing a discussion question, but the one I prepared, if we had, was why do you think so few patients receive mental health services following a TBI?